Good afternoon. My name is Joanne Blenman, and I want to welcome you and thank you for attending this meeting as I share a proposal of a strategic plan that will assist Children's Medical Services in actively achieving our mission to provide 100% access to quality health care for our members. CMS has all the expertise, commitment, and passion to be the best managed care plan. The goal of this strategic plan is to connect all the pieces together so CMS can become a more leading edge organization by setting strategies and an action plan to grow, improve services, connect, and inspire stakeholders. This plan has the potential to create mutual benefits for the Nurse Care Coordinator and Central Florida Region local CMS office. The objective of this presentation is to 1. Review Children's Medical Services mission statement, 2. Evaluate the SWOT analysis, 3. Identify the goals, 4. Identify the stakeholders, 5. Review the strategy map, 6. Identify the action and communication plan, and also to formalize the evaluation plan. Children's Medical Services mission statement is to protect, promote, and improve the health of children up to the age of 21 who has chronic and serious physical, developmental, and behavioral conditions through a comprehensive system of care. A SWOT analysis is a scan of the internal and external environment of a program, identifying strengths and weaknesses that are internal to a program and opportunities and threats external to the program in the environment in which it operates. Children's Medical Services strengths include specially trained nurses, care coordination, and social workers, national accreditation by the Accredited Association of Ambulatory Healthcare, access to wide range of primary, specialty, and facility providers throughout the state of Florida. There are 3 major state-of-the-art hospitals, children's hospitals in the area. Each CMS member is assigned a nurse care coordinator to work in collaboration with patients and families to promote timely access to appropriate care. Timely authorizations of services when ordered by physicians due to the competence of our nurse care coordinators. We have a long history of CMS services statewide dating back to the mid-1900s. CMS is recognized in the state as care coordination experts. Other HMOs and Medicaid managed care plans have mimicked our services. Weaknesses include low reimbursement for specialized services. Since we are a state program, we can only fund at the Medicaid rate. Non-competitive salaries for nurses and social workers. Retention of staff. Staff leave for higher paid positions in the private sector with better future earning potential. We also have non-flexible schedules. Other MMA plans offer telework and 10 to 12-hour workdays, which allow staff to work only 3 to 4 days a week. We also have shrinking budgets with growing number of health challenges and children with special health care needs. Our opportunities include the demographics in Central Florida region are changing. It is the largest growing region in the state. The counties we serve include Orange, Osceola, Seminole, and Brevard, and they are the fastest growing population in the state. Due to the influx of Puerto Ricans since Hurricane Irma has added to the change in demographics. We also need training in cultural competency and an increase of bilingual workforce to provide quality and consistent healthcare to keep up with the challenging demographics. The threats include Central Florida region as being the largest growing region. So if the growth is not looked at purposely, there will be compounded tension on the current CMS system. We have a great amount of competition from other HMO Medicaid managed care plans that have competitive budgets and can offer higher wages to staff. Legislative budget cuts also can make future funding of program difficult. We don't have enough parking spaces for employees in the building parking lots and not enough office space for growing work population because of increased special needs children. Key tenets of the strategic plan are 1. Improved quality of care. 2. Fostering excellence in our nurse care coordinators and maintaining a skilled and capable workforce. And 3. Growth and expansion of services in managing cost and financial health. These main concerns were established to direct our performance improvement efforts and assist the department in accomplishing our strategic goals. In the next few years, if we implement these goals, CMS will serve a larger number of special needs children more effectively with better results. Stakeholder management is critical to the success of any strategic plan, and when the right people are engaged in the right way, it makes a big difference in the success of the plan. A stakeholder analysis was conducted to identify key project influencers and opposers. Internal stakeholders are nurse care coordinators, social workers, clerical support, nursing supervisors, the nursing director, program administrator, and the medical director. External stakeholders included patients, families, Agency for Healthcare Administration, Department of Children and Family, and providers. Now I'll go on to discuss the strategies and tactics to implement these strategic goals. The goal number 1, which is to improve quality of care. A strategy is to have collaboration and team management. We need to involve all patients and families as members in vital committees throughout the organization so that there is a collaborative effort with patients and families in program development, implementation, and delivery of care. We need to have more patient education and shared knowledge. Nurses need to make time for patient and family education and give information that will help parents care for their special needs children in their home setting. Value will be placed on this additional time with patients so it can become a priority to the nurses. We're also going to have monthly, regular training and discussion with staff about patient interactions to ensure that nurses know what is expected of them in providing quality care. We can have scripts for situations such as delayed appointments, lost referrals to specialists, missing lab reports, so nurses can feel empowered to make conversation with patients and families easier, and this can also give them the means for taking care of difficult situations and reducing anger in families. Respect for patient needs, preferences, and cultural differences. Teach nurses to treat all families with dignity and respect. Listen and honor parents' perspectives and choices while integrating their values, cultural backgrounds, and beliefs in decision making. Empower the nurse care coordinators. We can establish a nurse quality committee to make decisions about safe practice, care, and clinical practice. Goal number 2 is fostering excellence and maintaining skilled workforce. Some of the strategies I can use is workforce planning. Create a diverse workforce that replicates the diversity of the patients and families we serve. Training. Support training of health professionals to ensure updating of essential knowledge and skill, and support technical assistance. Mentoring. Leadership can work collaboratively to develop and implement leadership development and provide on-the-job opportunities that increase staff development. Goal 3, growth and expansion of services in managing cost and financial health. Provide funding, technical assistance for health coverage outreach and enrollment activities of CMS members, staff, and other stakeholders. An integrated communication strategy can be implemented that's targeted different audiences and stakeholders. Establish collaborative relationships with providers, children's hospitals, and home health agencies. Ensure billing processes are managed effectively by setting up a recurring billing error rate that is less than 2%. Measure percentage of coding errors for providers through quarterly audits. The business functions that will be impacted by my action plan is planning and organizing. Using planning, I would identify the tasks which are required to achieve the desired goals, outline how the task should be performed, and identify who performs the task and when the task must be performed, allowing employees to participate in making these decisions. Organizing as a function is vital because it ensures there is a structure to the operations. During the function of organizing, it will be important for specific tasks to be assigned to the persons who are most qualified and provide the resources to the processes which is needed most. Now let us discuss the communication plan. The communication plan